Johnson. My name's Mary and this is Crystal. We're students with Lamar University. How are you doing today? Oh, that's good to hear. Can I get you to confirm your full name and date of birth for me? Thanks, Mr. Johnson. Well, the reason why we're here right now is because your doctor's ordered a 24-hour timed urine specimen collection. Have you ever done one of those before? Okay, well, no problem. We will gather up all the supplies and bring them in here to you and tell you all about it. And also, Crystal's going to kind of explain to you what the purpose of the procedure is.
Okay, so your doctor has ordered this for you because we want to monitor how well your kidneys are working and how well it's filtering your waste. We're doing it over a 24-hour span so that we can get a good image of how much output you're producing, and we can also run a urinalysis on the urine and see what is in it, like if you have any glucose or any elevated protein levels or other urine products. So your doctor's just doing this as a test to see what is contained in your urine.
Okay, do you have any questions so far? And do you feel like participating in this collection with us, because it is going to require a little bit of work on your end too? Okay, wonderful. Well, we're going to go gather up our supplies and we'll be right back.
All right, your bed is locked and low, your call light's right here, but we will be right back.
Hi, Mr. Johnson, we're back. I know, we've got lots of stuff. So, like I told you earlier, we're going to start a 24-hour timed urine collection. And so to do that, there's a little bit of preparation. Before, we're going to choose a time that we'd like to start that works for you and works for us. And then we're going to bring you some water about an hour beforehand. And hoping you can drink at least 2 glasses, which will encourage you to urinate around the time that we're wanting to start, because we want you to start the 24-hour period with an empty bladder. And so that first collection, that's going to be discarded, and then we're going to start the time from that point on until 24 hours has passed. Another part of this procedure is going to be that the urine needs to be strained as well. So Crystal's going to tell you a little bit more about how all of that works and what all this equipment here is used for.
Throughout the procedure, we're going to hang this little sign in your room and on the door that lets you know and reminds you about the procedure, because something I need to teach you is that it is very important that you collect all your samples, because if you happen to use the restroom and the toilet and throw the sample away, we have to restart the test. Some more education about this procedure. We don't want you to increase the amount of fluid you drink. It's going to be a regular test. We want you to take in as much fluid as you normally would. So don't overdrink any water or don't underdrink any water. Also, we want this sample, it's a clean procedure, but we want it to be as least contaminated as we can. So make sure that in the collection jug only goes urine. We don't want little pieces of toilet tissue or anything else to contaminate the sample. So I'm going to go over some of this equipment and how you would go about straining and collecting and helping us measure your urine. We have your big collection jug. It's sitting in this bucket full of ice. The reason why we put it on ice is to keep the sample cold to prevent bacteria from growing, because we don't want to alter the collection. And also if bacteria starts to grow and it gets warm, it can alter some of the lab values like your potassium levels. This is your urinal. I have a little sample water in here to show you. This is what you would be voiding into. Every time you need to urinate, you would urinate into this urinal so that we can strain it with your strainer here and measure it in the graduated cylinder to record your output before we put it in your big collection jar. We have a couple little specimen collection jars here for you too. We're going to go over what you would put in that, and Miss Mary will go over labeling it with you. Right, so I've washed my hands and put on clean gloves. We're going to remove your strainer. It's a reusable strainer, so we're going to leave this bag here for you to reuse. We're going to put it on top of the graduated cylinder. Now, every time you urinate, it is very important that you strain and measure so we have a correct measurement for each urination. You don't want to go multiple times and fill up the urinal before we do this. So you would want to open it and pour it through the strainer into the graduated cup. Alright, these specimen collection jars are for anything that we catch in the strainer. This is going to be like if you have any kidney stones or little calcium deposits or big proteins that we'd want to collect and send off to the lab to be analyzed. So we're going to empty into our container any little specimens we have. We're going to close the lid to the specimen container. Alright, now you can remove your strainer, and you see what you have in this graduated cylinder? Next to your bed, I'm going to have a little piece of paper so you can write the time and how much you have collected in the cylinder. So if we look, we have about 220 milliliters of fluid. So you'd write the time, right now it's 12:45, and 220 milliliters. It's important that you keep up with these measurements for us, or you can just hit your call light and we can come help you measure it and record it. So I'm going to take the urine sample and pour it into our big collection jug. This is going to hold all the combined urine for the next 24 hours. If this jug fills up and you need another jug, please hit your call light and let us know, and we can come grab an additional jug for you. It's important that you seal off this container so that it stays uncontaminated. Right? Miss Mary is going to go over a little bit more about the labeling of the products for you and how we're going to keep infection control.
Okay, Mr. Johnson, we have this sheet of labels that already has your name and date of birth to identify you, and we're going to place it on all of this stuff really on these containers that are going to the lab. So on these, since the date and the time are pertinent, and we need to mark that on each one. They can't all go in one together. So it's already going to have everything on it except for the date and time, and then there's going to be a little blank, and that's where one of your parts come in. We need you to add the date and the time, and then to call us, and we will come in, and with clean hands and gloves, we will add it into these biohazard bags and go ahead and transport it as they become ready to the laboratory. This also will be labeled with the source. I don't know if I mentioned these will have the source on it too, and that will already be on there. This also will have the source, your name and date of birth, and it'll have the date and the time span of the 24-hour period that we've been collecting. And then that will also, with clean hands and gloves, because we want to pay good attention to infection control, and we want to prevent contamination as much as possible, even though this is not a sterile procedure. Contamination is something that we really want to pay attention to. So we're going to take this labeled container, and we're going to put it in this bag, and we're going to also label this bag, and we're going to get you to confirm that all the information is correct. And I think that's everything. Do you have any questions for us? No? I know that this can be a little overwhelming. There's a lot of little steps. So if you need us along the way, please call us. We'd be so happy to come in here and help you with any of this. We're here to support you and make sure this gets done right the first time.
Right? Also, whenever we get your test results back, so after the 24-hour period is up, we send it off, we get your results back. It is our duty as the nurses to analyze your urine and your urinalysis, and if there's anything abnormal, we'd want to report that to the physician so we can start a treatment plan that'll be good for you. Like if they analyze an elevated glucose level, then we would want to talk to him and see if the physician would want to start insulin or any diabetic control. At the lab, some of the things they're looking for is they'll be looking, like I said, for glucose, which is your blood sugar. It should range from 70 to 99. They're also looking for these kidney function indicators. So we want to make sure there's no proteins in your urine, and the indicators are creatinine and BUN. The creatinine level should be from 0.7 to 1.3. So if it's elevated, we know there's kidney damage, and your BUN should be from 9 to 20. That also being elevated is showing that there's a buildup urea and you're not being able to process waste quickly. So with these lab results, when we get them back, like I said, we'll explain your care plan and talk to the physician and see what he'd like to do going forward. Are you comfortable with this procedure? Do you feel as if you could help us collect your urine and strain it and label everything properly? Right, and like we have said before, if there's any doubt or you have any problems at all, hit your call light. We can come in and help you. It's very important that we collect all urine for the next 24-hour period. So we're looking to start this procedure at about 1 o'clock. So Miss Mary and I are going to go prepare you some water, and we'll come back over and address any other issues you might have. All right, thank you, Mr. Johnson, for your participation. We're going to lower your bed down. It's going to be locked. We have your call light right here. Like I said, we'll be back in a second, but if you need anything, please do not hesitate to call us.